Welcome to today's talk. I've got some interesting information from the United States I'd like to talk about, and we'll combine that with some news from the US, and then we'll look at the UK afterwards. But going straight on to the United States at the moment. So the cases in the United States have gone up by over 400,000 in the past 7 days. So well over 400,000 new cases in the last week. And we're heading towards the 8.5 million mark of cases. And this is data from the CDC. So we've gone back to CDC data. That other data I was looking at, quite a few of you thought it was unreliable. So although the CDC is not perfect, it's probably still the closest we've got to the actual situation, albeit with a bit of a delay. And the CDC death figure at the moment, 220,000 people in the US sadly died from SARS coronavirus 2 causing COVID-19 disease. Now, this is the sort of trend in the States. I've just put this in bigger letters so you can see it because so that's the 10,000 line, 20,000 line, 30,000 line, 40,000 line going across there. January, of course, blissfully no cases. April, July, October. And there's no question at the moment is that this direction is up the way. The question is it up the way like this? Or is it up the way more moderately? Or will it be heading back down again? And that's what we don't know at the moment. But there are a few reasons to be pessimistic about the United States, particularly as the fall and winter approach. And this is certainly the feeling of Dr. Butler, I think he is the second in command, as it were, at the Centre for Disease Control under Dr. Redford. Anyway, one of the big cheeses at the Centres for Disease Control Prevention. He's describing a distressing trend. Not a good word, but it's what he's using, so we need to accept it. Increasing in nearly 75% of the country. So 3/4 of the United States cases are increasing. Not everywhere, it's a big country, of course, it's basically a continent. But 3/4 of places it's increasing. And he says this past week we've seen nearly 60,000 cases a day as an average, as well as 700 deaths. So we're into the 60,000 a day category, and we can see this from this graph we've just looked at here. So that's the 60,000 line going across there, and we can see that unfortunately the averages are in that kind of area now. These ones above 60,000 in terms of daily cases. So definite resurgence there alerted by Dr. Butler from the Centres for Disease Control. Now, past 2 weeks, he pointed out there's been a great increase in Illinois, Indiana, Michigan, Minnesota, Nebraska, Wisconsin. Now, I'm no great expert on American geography, but this is clearly the Midwest where there's been the most increase in cases. And the cooler weather is forcing more people indoors. Now, I've seen this in the UK. Already people are closing the doors because it's cold, they don't want the draft. And of course that means the air is not recycled, so any viruses in the air can hang there for hours. We have to get the ventilation right. If that means being a few degrees colder than we'd like to be in autumn, fall, winter time, so be it. At the moment we're just not ventilating. We are closing the doors and the windows to keep warm as if this is a normal year. Well, it's not a normal year, this is the COVID year. Now next winter should be okay. This one is not. And we are not getting the ventilation right. And I've been talking to people who run various organisations, and a lot of them just don't seem to get this ventilation bit. You know, open doors, get a through draft. It's not happening, and it's a major factor in the Midwest, the northern states, Canada, and of course the UK and many parts of Europe. And you try talking to people around about you. It's really hard to get this message across. You'll go into some venue or other for some reason, and it's just not properly ventilated. Okay, people will be wearing masks. There's hand sanitizers all over the place. Social distancing is largely observed, but the atmosphere is stuffy. This virus spreads by droplet and aerosolization. It can hang in the air. We need to ventilate. And we're not. We're simply not at the moment. Most places are not. Again, this is a comment from Dr. Butler, Centers for Disease Control, direct quote, smaller, more intimate gatherings with family, friends and neighbours may be driving infection. So this seems to be a big infection driver at the moment. So group of people, you probably know them, you probably trust them, almost certainly you will. Perhaps you'll trust them with your life, but the point is they won't know if they're infected or not, and you don't know necessarily if you're infected or not. So that's the infection driver at the moment. Now, we've talked quite a lot about infection fatality rates lately. And I've just come across a new paper. It was actually published more than a week ago in the Journal of the American Medical Association, but we'll have a quick look at it. I think we might have looked at it briefly before, but it's the 1st of March to the 1st of August, that period of time, 1st of March to the 1st of August. Now, the deaths in the United States there, 1.3 million, okay. But the point is that's a 20% increase over the average. A fifth up on what we would expect from the 1st of March to the 1st of August in the United States. Now, the highest per capita areas have been these: New York, New Jersey, Massachusetts, Louisiana, Arizona, Mississippi, Maryland, Delaware, Rhode Island and Michigan. So these have been the highest per capita areas, not necessarily with the highest number of deaths from COVID-19, but with the highest excess deaths over that which would be expected in a typical year. And as we've said, this is not a typical year. And the states that reopened early experienced more protracted increase in deaths, of course. We know this. This is accepted and known. Now, of the 225,000 excess deaths, 150,000, 67 were attributed to COVID-19. So only 67% of the deaths. Now, this is a surprisingly small number. Only 67% of the deaths were attributable to COVID-19. So why is this? Well, some people probably died of COVID-19 that weren't officially diagnosed. That could account for a few. But this is what we're seeing, what seems to be called the collateral damage of the pandemic. People not seeking treatment, people not being able to access treatment, people being fearful to access treatment, and the general upset of the lockdown and the community control measures that have been taken. Put these factors together, we can't necessarily say which bit is the most significant, but all these things together have caused a lot of excess deaths, because only 60-70% of the excess deaths are attributable to COVID-19. And this could rise. This overall excess deaths, and these overall excess deaths are not included in the infection fatality rates. So the pandemic is causing more deaths than COVID-19, significantly more than COVID-19. Now, this paper in Journal of the American Medical Association pointed out that only 2 other causes reached statistical significance. Now, others were mentioned, but they didn't reach significance. But the ones that reached significance were heart disease and Alzheimer's disease and dementia type illnesses. Deaths from heart disease were significantly higher than normal. Deaths from Alzheimer's disease were significantly higher than normal. Now, we have to have a high index of suspicion for heart disease all the time. What can happen, and it's the most common cause of death, in the UK still at the moment, and still in the States, I think, is that one of these coronary arteries where the blood should flow freely through the coronary artery, they get clogged up with fatty material called atheroma, and that triggers off blood coagulation, and you get a blood clot that blocks off the artery. When the artery is blocked off, that means the blood supply does not get through to the area of myocardium it's supposed to. In other words, a coronary arterial thrombosis causes a myocardial infarction. Part of the heart muscle will start to die. And that can cause all sorts of complications, such as ventricular fibrillation, which is a cardiac arrest. So we have to maintain, this is not new, we have to maintain this really high index of suspicion for myocardial infarction. Acute chest pain is an automatic red flag. So typically the pain starts towards the centre of the chest. The heart is slightly towards the left, but typically the pain starts in the centre of the chest. It often goes up into the left shoulder, sometimes down the left arm into the fingers. It goes down into the epigastric area, sort of down here at the top of the stomach sometimes. It can go up into the neck, can go up into the jaw. Occasionally it can go to the right side, but that's less common. So any of these acute pains, just please remember, because there's so many treatments that we can do, but we need people that are suspicious that they have acute heart disease to get treated as normal. It becomes an overwhelming medical need. So sad to see that heart disease deaths and deaths from dementia are increased. Why deaths from dementia should be increased, less clear. Could be related to caring deficits, but the data's not there. But we need to minimise this this additional damage and this additional harm that the pandemic is causing. And of course, this applies wherever you live. It's always difficult to know what to put in these broadcasts. It's only me prepare them, so I have to sort of just put in a few things together that I think illustrates what's going on. I mean, we could be talking about increasing cases in the Czech Republic, or indeed there seems to be a bit of a resurgence in South Africa at the moment as well. But I just try and put things in that apply everywhere, and this thing about minimising excess deaths from other causes during the pandemic applies everywhere, and it's just such an important message to get across. Now, other important messages as the weather gets colder. Now, this is from an interesting study. I think I'll just go through it systematically. But the Centers for Disease Control have actually changed their guidelines as a result of this study that they've done. Now, close contact, 6 feet and 15 minutes. Now, of course, you don't need to be 2 meters, 6 feet. You can get the infection if you're further away from someone. You can get it in quicker than 15 minutes. But this is kind of used as a kind of operational definition. And I must say, I don't like it. It's too prescribed. I mean, you could get this disease if someone coughs over you in 30 seconds. If you get a high viral load. You could get this disease if you're 4 meters away from someone because of the aerosolization as the virus diffuses through the atmosphere in a poorly ventilated room. So I don't like it, but it is taken. It's kind of an operational definition, and okay, we've got it, so we'll live with it. But what this study is showing is that cumulative exposure can be as hazard as a 15-minute sustained continuous exposure. So it's saying low doses of the virus, but a cumulative exposure can be just as risky. Now, this is based on this report from the Centers for Disease Control. Correction facility, I think it was in Vermont. So what happened was there was a 20-year-old worker. He had multiple brief encounters with 6 out-of-state arrivals who were quarantined, as you would expect, as is the protocol. All tested positive the day after. So all of the 6 out-of-state arrivals tested positive the day after their arrival. Then a week later, the officer himself, loss of sense of smell and taste, muscle weakness, runny nose, cough, shortness of breath, headache, loss of appetite, upset stomach. Wonder what that could have been. Well, of course, he did test positive. Yeah. So he was officially diagnosed and tested positive. All the 6 detainees were asymptomatic when they arrived from out of state. We're not told if some of them became ill later on or not. We assume some of them did, but they were all asymptomatic. So the point is that this officer was exposed to them on a very short-term basis, just for a minute or two. But when they added it all up, it actually came to 17 minutes, not 15 minutes. And they did that because there was video surveillance in all of the interactive areas. So the video surveillance was everywhere. And the Centers for Disease Control looked at this video surveillance and were able to work out quite precisely the level of interaction between the officer and the inmates. And there was also a very low incidence of COVID-19 in Vermont at the time. This was in July. And they worked out that was the only place he could have got it. So what it seemed to happen was he was talking to the prisoners, albeit very briefly, and the masks were not worn in cell doorways. That seemed to be the main factor. So the additional factors in the spread are the proximity, how close people are, the duration of exposure, and the infected person's stage. Now, all of these prisoners, they all tested positive. The results came back, they tested positive the day after. So most of them presumably were in the 1 or 2 days before they got symptoms. This pre-symptomatic infectious stage. They would probably be slightly more infectious when they first developed symptoms. They would be way less infectious a week after they developed symptoms, way less infectious. So the viral load that they would be giving out would be a critical factor, and they're obviously giving out more than enough to infect this officer, who was only 20, by the way, so he didn't have comorbidities. He was fit as well. How likely someone is to generate respiratory aerosols and respiratory droplets. Now, some people, and it may well have been that one of these inmates or more of these inmates were in that category, some people just excrete or blow out way more respiratory droplets than the average person does. I might be one, you might be one. We might be a super droplet former. We don't know. This is one of the reasons that people can be super spreaders. So that could have been another factor. Ventilation and crowding, obviously mentioned as a factor. And we did look at the high cases in other prisons in the United States. Just last week, I think it was. Now, the thing is that the guide decisions on quarantine and work restrictions are this 6 feet for 15 minutes. This what has to be called a very simplistic, very simplistic assessment of the risk of transmission. So what has been learned from this, according to the Centers for Disease Control and other experts that have commented, people with or without symptoms can be highly infectious. Yes, we know. The inmates gave it to the prison officer. Importance of wearing face masks to prevent infection. Good, it reinforces that. The more time you spend with someone, the more likely you are to get infected. So it's, yeah, okay, that's true, but you can get infected in a short time as well. It may have been that one of these 6 prisoners was a super spreader, as I said, shedding a lot of droplets and therefore shedding a lot of the virus. So, as a result of this, the Centers for Disease Control has updated its guidelines. Actually, I think it's about to update its guidelines. I did look this morning; it didn't seem to be updated yet, actually. But it is going to update its guidelines to point out that it's not just 15 minutes; it's the cumulative time. So 7 episodes of 2-minute exposure are just as dangerous as one 14-minute exposure. That's what it means. So that's new, and it's good that the Centers for Disease Control are able to learn from these case studies. They're basically case studies. But that one was, all the information was available on video, and they did that very thoroughly, so I thought that was well worth bringing to your attention. Right, moving on to the UK. Huge amount of increase in cases past 24 hours. And when we look at the graph, we see this, don't we? Now, these lines here are you can't see it very well, but that would be 5,000. That would be 10,000. That would be 15,000. That would be the 20,000 line there. 5, 10, 15, 20. So we see we're now well over the 20,000 line. That's the 25 line there. That's just there, 25 line. So over 25,000 cases in this 24-hour period. Each of these bars here represents the increase in cases in one 24-hour period. So this is a steep increase in the UK. Symptom Tracker app says 36,000 people experience new symptoms in the 24 hours, giving rise to 450,000 active cases. Now, and those numbers are for the UK as a whole, which I'm pleased to see data from the UK as a whole. Now, Office of National Statistics, this is for England. Now, it really is, and this is a constant source of irritation to me that this data is broken down so, we don't get whole UK data, but anyway, it's what we've got. England community infections, this is the week from the 2nd to the 8th of October, always the delay, of course. 336,000 people with infections. That's 1 in 160 people. So 1 in 160 people had the infection that week in the UK. Fairly high numbers. Largely teenagers and young adults, but increasing numbers in older age groups as well. And obviously the infections have been increasing rapidly. Now Wales, just under 8,000 infected people. That's 1 in 390, so that's one person in 390. So we see that the infection rate in England is much higher than the infection rate in Wales. And yet it's Wales that is imposing the lockdown from Friday, tomorrow. Is it Thursday today? I think it is. From tomorrow. Anyway, it's from Friday at 6 p.m. Why is Wales taking much more dramatic action when it's got less than half as many infections? The answer seems to be that Wales is less confident of its hospital and intensive care capacity. Some reports are saying there's been mismanagement in the Wales National Health Service. I don't know, but what we do know from the Office for National Statistics is that 1 in 160 people in England, 1 in 390 people in Wales are infected, and yet it's Wales that has gone for the full lockdown for this fire break, circuit breaker, whatever you want to call it, event. Northern Ireland in between 1 in 250 people. Now, we have this tier system in England at the moment. And there's no doubt about it, it's actually quite complicated. Let me tell you what I think, my reading of it at the moment. Tier 1, we've got the curfews for bars, pubs and restaurants, so they can open through the day, just got to shut at 10 p.m. People do seem to be spending more time in the streets, but probably less so as it's getting colder. Gatherings of more than 6 people banned except for funerals and weddings. But this does appear to apply indoor and outdoor, so it's a bit confusing as to what the next tier says, but let's have a look at it. So tier 2, I guess the difference is that mixing of households indoors is not allowed. So the rule of 6 here, you couldn't have 3 people from 2 different households. I think that's the main difference. So mixing of households indoors not allowed under tier 2, the high regulations. And the rule of 6 applies to private gardens and outdoor spaces. Now this is what confuses me a bit, because I thought it did apply to outdoor spaces in tier 1. But this is what the regulations seem to be saying. So this is the big difference. We have to stop the indoor household mixing in Tier 2. But I must say they're not as clear as I'd like them to be. Pubs and restaurants remain open, but no mixing of households inside pubs or restaurants. That's another difference. So yeah, I guess in Tier 1, the rule of 6, you could have people from different households in a pub. Under Tier 2, you can't have people from different households in a pub. I guess that's the crux of the difference, but I wish they'd find a simpler way to communicate it. Pubs and bars to close under Tier 3, that's a clear difference. Pubs and bars close. Restaurants can open. Now, restaurants are allowed to serve alcoholic drinks with meals, and they can remain open. But pubs that are just selling alcohol can't remain open. So I think the phrase is something like if they're selling a substantial meal or something. So whether a pub selling a pork pie or a Cornish pasty would count, again, it's a bit unclear. But that is the regulation. Presumably that wouldn't be allowed. So pubs and bars to close, places that focus on drinking, whereas restaurants can open if but they can sell alcoholic drinks with the meal. So I think it's very much a case of needing to follow the spirit rather than the letter of that law there. I mean, I think we all know the difference between going into a restaurant and going into a pub. That's what it's getting at. Of course, avoid non-essential travel in or out. Don't stay overnight in an area, a Tier 3 area. But these are advisory. These aren't mandated like these ones are. Schools and universities remain open. Now, again, the evidence base here is not high. I mean, I think for universities it's probably unambiguous. Sending students home would spread more infection around the place as they travel and go home. So I'm quite happy to leave these students in the university areas. Schools, everyone keeps telling me that children spread the virus less than other people, but the evidence for that is not entirely clear. But that's what's happening. Wedding receptions aren't allowed. You can get married, but you can't have a reception if you're in a Tier 3 area. Okay, now these are the list of the 4 regulations. So these are the regulations for England. These are the regulations for Scotland. These are the regulations for Wales. And these are the regulations for Northern Ireland. So you can see why it's confusing because of this balkanisation that we seem to be having in the UK at the moment. And we've just had this completely undignified row between the Mayor of Manchester and central government. Again, the country seems to be divided as in an unfortunate way, which means we're not moving together in a coordinated, cohesive way, which will provide an open door for the virus. It's a pity that this is the state we're in. The pandemic's exposed many weaknesses, and that's probably just one of them. Okay, plenty good things to be thinking about there, but I'm just thinking about these problems. I don't have an immediate solution for them, which of course is probably why we're in the situation that we're in. Anyway, I'm delighted that you and me have been here. Thank you for watching as always.